Hi guys, Jane here. Welcome to a new video. This video is going to be about bulimia nervosa. What is bulimia nervosa? Let's find out. Now before we start this video, I just want to start off with a disclaimer. I am not a mental health professional, therefore please do not use this video as a diagnostic tool. Rather, it is just an educational video that can inform the general public about what bulimia nervosa is. Now, even though I'm not a mental health professional, I have extensively researched about this topic. Therefore, if you want to confirm the validity of my research, please click on the links down below and you can see all the resources that I've used. Now, given the large amount of information that I have collected, I can't possibly cover everything in one video. So if you guys want to learn more about bulimia nervosa, please feel free to check out the links down below. Now, what is bulimia nervosa? It is an eating disorder that is characterized by a cycle of binging and purging. Now, some people might be like, okay, what is binging and what is purging? Well, we're going to clarify those terms later in the video. Now, there's been some confusion with binge eating disorder and bulimia. Now, there's definitely a difference between those two in that binge eating disorder does not have the purging component, unlike bulimia does. So, both of them do binge. They eat large amounts of food in a given sitting. But unlike people with bulimia, people with binge eating disorder do not have compensatory acts after they binge. They don't try to throw up or try to expel the food that they have already eaten. Now, what is the diagnostic criteria for bulimia? Well, number one, there must be recurrent episodes of binge eating. Now, an episode of binge eating is characterized by both of the following. Number one, they eat in a discrete period of time, and the amount of food that they eat is way larger than most people would eat in a similar period of time and under similar circumstances. So what do I mean by this? For example, let's just say that the discrete period of time is in 2 hours. Well, in 2 hours, they can eat mountains and mountains of food. Like they would eat Doritos, 4 burgers, 5 bags of Lay's chips, and they gulp down a really huge big gulp. That's a lot of food. But for most people, they cannot eat that within a 2-hour span. Number two, there must be a sense of lack of control while eating or during a binging episode. So what do I mean by this? Many people with bulimia often feel like they're on autopilot, like they have no control over their body. Even though they want to stop eating, their body doesn't listen to them. It's just like they just feel out of control. Now, if there's going to be the binging episodes, there are going to be the purging episodes. There must be recurrent, inappropriate, compensatory behavior in order to prevent weight gain. Now, what do I mean by this? Basically, they try to compensate for the large amount of food that they have eaten so that they don't gain any weight. And how can they do this? Some of the ways that a bulimic can purge is self-induced vomiting, misuse of laxatives or diuretics, or other medications that can help induce bowel movement. They might also fast, and they might also partake in excessive exercise. Now, there are several more items in the diagnostic criteria. One of them being that the binge eating and inappropriate compensatory behaviors must occur on average at least once a week for 3 months. So that's the duration that they must have in order to be diagnosed with bulimia. Also, bulimics experience self-evaluation that is indolently influenced by body shape and weight. Now, what do I mean by this? Basically, they are very heavily critical about themselves, especially when it comes to their body shape and weight. When they feel like they're gaining weight or they feel like their body shape isn't as perfect or slim as they want to be, They base a lot of their self-worth and they critically self-evaluate themselves. the disturbance does not occur exclusively during episodes of anorexia nervosa. Now remember, I made a video about anorexia nervosa. If you guys want to check that out, please click on the link right here. In that video, I addressed this question. Well, what is the difference between bulimia nervosa and the binge/purging subtype in anorexia? Now, those two sound a lot like the same thing. However, remember what I told you in that video, that if the person has anorexia and they also have binge/purging symptoms, then the diagnosis for anorexia supersedes that of bulimia. Therefore, another condition in the diagnostic criteria for bulimia nervosa is that they have to rule out anorexia in order to actually diagnose this as bulimia. Now, what are some risk factors of bulimia? Number one is genetics. So, for the people who have relatives, parents, siblings that have bulimia are more predisposed in developing bulimia later in their lives. Now, if the relatives, parents, or siblings had other eating disorders, they are also prone to getting bulimia as well, or other eating disorders. Number two is psychological and emotional issues. It's not just bulimia. Under that is depression, anxiety, substance use disorders. There are a lot of disorders out there that can really coexist with bulimia. We don't know. Is it those disorders that's causing the bulimia, or is it the bulimia that's causing those disorders? We're not sure, and it differs for every person. However, one thing is clear. Those other mental health disorders can become a risk factor as well. Number three is dieting. So many people want the slim bodies and they want to look good in the summer, and I completely understand that, but sometimes it can get out of control. Some people have very, very restrictive diets. So they can't eat certain foods, their calorie intake is really, really low, and when they're partaking in that unhealthy diet, it can induce binging and purging episodes. Other risk factors can include stress, poor body self-image, and boredom. Boredom can definitely be one of them as well. Now, what are some psychotherapy treatments for bulimia? Well, number one is CBT, which stands for Cognitive Behavioral Therapy. CBT is very helpful because it allows the person to realize how they think when they are eating, how they're thinking when they're binging, and how they're thinking when they are purging. So once they know how they think and, okay, what kind of thoughts am I having while I'm partaking in the binging and purging episodes, and they see the mistakes and flaws in that through the help of a mental health professional, and they slowly try to change it into more healthy actions and dieting than their previous practices. Number two is family-based treatment. Basically, this allows parents and other family members to intervene in the bulimic's unhealthy eating behaviors, and it can help the teen regain control over their eating behaviors and solve any problems that their bulimia has had on their family and themselves. Number three is interpersonal psychotherapy, which is basically trying to address the difficulties in close relationships, so therefore it can help improve one's communication and problem-solving skills. Now they're like, okay, why do you need interpersonal therapy? Well, some people might have developed bulimia because of stress and because of very difficult interpersonal relationships. So this is definitely another therapy that they can do. Now, there are definitely a lot more therapies out there, but these are several of therapies that I've gathered in my research. If you guys want to find out more, feel free to check out the links down below. Now, what are some medications that people with bulimia nervosa can take? Number one, antidepressants. Similar to Anorexia. Antidepressants can help the depression and anxiety component in bulimia. A lot of the antidepressants that people give out now these days are SSRIs. Some really popular medications that belong in the SSRI family are Prozac, Lexapro, Celexa. Some severe cases will require hospitalization. Therefore, in those cases, more medications that are appropriate to that person's treatment and restoration of health will be administered. What are some statistics of bulimia nervosa? I'm just going to read it off of here. So, number one, it is estimated that up to 4% of females in the United States will have bulimia during their lifetime. Wow. Number two, of those practicing bulimia, only 6% obtain treatment. Now, I was very surprised when I saw this statistic because I realized how little help that people with bulimia are getting. Only 6% obtain treatment. Number three, rates of bulimia increased during the 1980s and early 1990s, and they have since remained the same or decreased slightly. What are the signs and symptoms of bulimia? Well, first of all, there are definitely notable fluctuations in weight. It can go up and it can go down, and it's just fluctuating a lot. The body weight can be within the normal range, or sometimes it can be overweight. That's where it differs from anorexia and bulimia. Anorexia, they're way below normal range in weight, but for bulimics, that's not the case. Now, stomach cramps, constipation, difficulty concentrating, fainting, dizziness, nausea, feeling cold all the time. There can also be missed periods, fine hair, and poor wound healing. Now, these symptoms sound a lot like the symptoms that manifest in people with anorexia. Now, I'm not trying to downplay these symptoms, but these symptoms are not as severe as other severe complications that might arise in the future. Now, this is where it gets complicated. Bulimia can lead to a wide range of undesired complications. It can cause irregular heartbeats, and repeated vomiting can also erode the enamel in one's teeth, so it can also lead to tooth decay. Also, bulimia can cause fertility issues as well, and they can cause chronic gastric reflux, and the inflammation of the esophagus is also very common as well. People with bulimia can also run the risk of developing substance use disorders. Now, this is very, very dangerous because some of the medications for bulimia can have serious and dangerous interactions with recreational drugs. Now, if those interactions happen, it can cause heart attacks, it can cause deadly side effects, and it can definitely lead to death in the long run. Also, they are an increased risk for suicide as well. What are my final thoughts on bulimia? It's very much similar to anorexia, but I definitely believe that prompt treatment is necessary. I am very well aware that there is stigma that is attached to bulimia as well as all the other eating disorders. And I understand that that stigma exists and it can hurt a lot of people. But we should not be ashamed of bulimia. People who are bulimics that are watching this video, or people who might suspect that they have bulimia, or people who have loved ones that suffer from bulimia. We should not be ashamed of this. Just because they have bulimia, that doesn't define who they are. They need help. Therefore, prompt treatment is definitely necessary. If we conquer that stigma and overcome the negative stigma that is attached to bulimia as well as other eating disorders, it will encourage other people who have bulimia to step forward and seek treatment. Because I know that there's a lot of shame that is involved in wanting to get treatment, because many people might perceive you as weak, or you might perceive yourself as weak. But that's not true. Getting help is one of the most bravest things that anyone can ever do in their lives. Thank you so much for watching. I upload a video every week, so please stay tuned for the next video. I don't really have a specific day that I post my videos. However, you can expect either Monday or Friday. If you enjoyed this video, please like it and subscribe down below and do all that jazz, and I'll see you next week. Bye guys.